3 of our shoulder program today. So we'll dive right into it today. We're going to start with a bit of a challenging movement. It's not challenging in the sense that it's super complex, but it's challenging in the sense that oftentimes we find individuals are just completing this movement in the wrong manner. So what we're going to do is we're sitting up nice and tall. And in phase 3, we kind of talked, or in phase 2, we talked about driving and using the headrest improperly. So oftentimes you see people driving and they're out in front like this instead of simply pulling their chin back. You can hear my voice change a little bit right there because of that motion that I'm doing affecting the vocal cords a little bit. But that's exactly what we're going to work on today. We're going to work on some cervical retractions. So a cervical retraction is not a tuck down and then a raise here, okay? A cervical retraction is going to require us to keep our head in the same plane of motion and simply push it back to this position here. So again, you can hear that change in my voice because there is a different strain on the vocal cords and the muscles of my neck that are affecting how I can vocalize, all right? So I'm sitting up nice and tall here. One thing I recommend is putting your finger on your chin here, okay? You're gonna look straight ahead. I want you to focus on something straight out in front of you because if your head goes down and you lose that focus, you're not completing that exercise properly. So as what we're getting into again today, we're getting into some cervical retraction. Finger on the chin, I'm going to pull my chin back and then push it forward. Pull my chin back, push it forward. Pull my chin back, back, forward, pull my chin back, forward. If you're having trouble doing this from this seated position, you can do it from a standing position. Put a pillow behind your head and really try and push that head back into the pillow. Again, I am not changing my voice here. That's just based on the muscle interaction that's happening. Try that one out. All right, the next two that we're going to get into are going to come from the wall here. So I'm going to put myself up against this wall right here, technically a door, but we're going to go up against the wall here. We're going to get into wall crawls. So again, we've done this exercise in the past in our weekly exercise programs. So if it looks very familiar, you've seen it before. All right, so what I'm going to do is I'm going to go over to the wall here. I'm going to simply walk my hands up the wall. All right, sounds simple, right? But one thing we have to focus on is, again, that core and that tension within the core. All right, so if I'm walking my hands up a wall and I'm starting to get into this position here, and I got that big arch of the spine, again, that is not going to be productive in an exercise session, and frankly, you're not going to be helping your shoulders out any bit, okay? Because you're performing this movement in a poor posture position. So again, when I come over to the wall, I'm going to brace my core. I'm going to start with my arms at about 90 degrees, and I'm going to, just as it sounds, crawl my hands up the wall. I can either slide down or I can crawl back down as well. Complete 15 repetitions with this exercise as well. I'll show you a couple reps here, then we'll move on. Core is braced, starting at 90, and I'm going to crawl my hands up the wall. Again, I can crawl them back down if I so choose. I'll crawl them up, and I can also slide down. We're going back to the wall here for this next one. There's different names for this one, wall slides, things like that. I like to call it snow angels, especially for my Midwesterners, my Northeasterners that have now planted themselves down here in Southwest Florida. Gets us back to the good old days of their time up in the north with the snow. All right, so we're going to get into, again, snow angels. I'm going to put myself up against the wall behind me here. Again, my core is going to be braced, and I'm going to, just as I would in the snow, take my arms up and overhead. All right, so when I'm on this wall here, what am I looking for? Core is staying braced. I'm also going to have my palms facing out. That's going to be the external rotation of that shoulder. Again, the strong, stable position here. We're trying to move our arms up as high as we can without any pain and without losing that tension. But one thing I will say with this exercise, your feet can come out away from the wall a little bit. That's going to allow you to push your back into the wall easier. But the closer your feet are to the wall, if your heels are touching, it's going to be much tougher. So go ahead and give it a shot with your feet out in front a little bit, and then work your feet closer if you can. So, again, I'm here. My feet are out a little bit today. I'm going to go ahead and pull my arms back, and then I'm trying to slide as high as I can without losing that tension of my spine. Alright, just like we practiced earlier with our cervical retraction, you're trying to pull the head back to the wall as well. It is not a kink in the neck to pull it back. You are trying to keep everything pressed into the wall here. Alright, so as you can see with my feet out in front, I can go pretty well up and overhead. Now I'm going to go ahead and pull my heels to the wall. Again, everything is tucked back, and you're going to see this movement becomes a lot tougher. Alright? So, for someone like myself, I'm going to rotate between both movements so that I can increase my range of motion. But if this position here with your heels up into the wall proves to be too difficult, maybe you're only getting up to about parallel, I recommend walking those feet out, really working on that position there, and then as you progress on that, trying to move your feet closer to the wall. Good news! Last exercise here on our shoulder program for phase 3 of 4 is simply going to be a stretch. Alright, so we're going to go into a posterior, so backside capsule, shoulder capsule stretch. So what we're going to do is we're going to take our one arm. I'm going to take my left arm out in front for right now. Doesn't matter if you have an open fist or closed fist. I'm going to take my opposite hand, put it on my elbow, and then I'm going to take this arm across my body. Alright? From here, I'm going to try and put a little bit of pressure into that elbow and bring that bicep, so bicep, into the chest. Alright? We'll hold for about 30 seconds here, and then you'll end up switching sides. Okay? With this exercise, one thing you might want to practice is taking some nice deep breaths. Alright? So as I take a nice deep breath in, I can kind of allow myself to feel that stretch become deeper or pull into my chest a little bit more once I release that air. Alright, so I'm right into this position here. I'll take a nice deep breath. As I release the air, I'm going to try and pull into my chest slightly more. I'll go ahead and inhale again. And again, try and pull into my chest deeper. So again, go ahead and complete that exercise on both sides, and your shoulders should start to be feeling pretty healthy here. Check back for the 4th and final week next week, and then we'll put it all together so that you can have one big program if you want to kind of stay in tune with your shoulders or practice this one pretty regularly.